Well, I have right up on the hour, so I think we should get started. Everyone ready? All right, so welcome. Hello, everyone, and welcome to the final day of the 2024 Public Health Learning Forum. We can hardly believe how quickly this week has gone by. And we're so excited about our first session for today, Unlocking Potential, Enhancing Capacity Through Academic Health Department Partnerships. I will quickly review the housekeeping items. And for those of you who have joined us several times this week, these will be the same. Audio is available on your computer or your phone. We kindly ask that you keep yourself on mute, but we do encourage you to keep your cameras on so we can see your faces as we go through the session. Feel free to drop your questions at any time into the chat, and we'll do our best to respond as we go. But you know there will be a question and answer time with the presenters following their presentation. If you have any technical questions today, please send a message in the chat to Nolan Gill or Jennifer Harmon, who will be our tech support for this session. Thank you, Nolan and Jennifer, for keeping us all going. All sessions are being recorded and will be available on the Train Learning Network in the coming weeks. Once the trainings are live, all participants will receive an email with the details. In the next 90 minutes, you will hear from members of the Academic Health Department learning community. Sarah Worthington is the Academic Public Health Manager for the Toledo-Lucas County Health Department, where she enhances student experiences and fosters academic partnerships while also developing workforce training opportunities. Christine Beluk serves as the Academic Health Department Manager at the Massachusetts Department of Public Health. Drawing from her extensive background in higher education to support student engagement and civic involvement, she is dedicated to bridging academic and public health initiatives to empower our future leaders. And Mayela Arana is the Senior Program Manager for Workforce Development at the Public Health Foundation, where she supports the Council on Linkages between academia and public health practice, which includes the Academic Health Department learning community. The full version of their bios are available on the resources section of the conference page on Train. By the end of this session, you should be able to describe academic health department partnerships, demonstrate how academic health department partnerships contribute to health department capacity, and identify opportunities for academic health department partnerships to strengthen the public health workforce. Throughout this session, we'd like to encourage you to continue learning about the Academic Health Department partnerships by joining the Academic Health Department learning community at this link, www.phf.org/AHDLC. With that, now I'll turn it over to Mayela to get us started.
Wonderful. Thank you so much, Carol. So with that quick overview, I'm just going to go ahead and dive right in. As we start talking about academic health department partnerships, I wanted to provide a little bit of context by introducing the Council on Linkages between academia and public health practice. The Council on Linkages is a consensus-driven collaborative of national organizations engaged in public health that work on initiatives designed to benefit the workforce broadly. The Council on Linkages has been around for more than 30 years, has 24 member organizations that you can see on this slide, and aims to improve the performance of individuals and organizations within public health by fostering collaboration between academia, public health practice, by promoting ongoing education and training, and strengthening public health infrastructure. Members of the Council on Linkages span a variety of professional groups in public health, as well as federal agencies, the accrediting bodies for both health departments and academic public health, and the certifying body for public health professionals. And the Public Health Foundation serves as a convener and provides staff support for the Council on Linkages. So you might be wondering, what is an academic partnership? And that's where we're going to get started today. I'm just going to begin with a quick definition. Academic health department partnerships are partnerships that have been built between health departments and academic institutions. These partnerships can take a variety of forms, but at their core, they are collaborative, mutually beneficial relationships that serve to strengthen and formalize collaboration, to move the relationship between the organizations beyond working together sporadically, maybe because two individuals happen to like each other, to being more of a regular part of how the organization operates. So these partnerships can help to enhance public health education and training, can help with research and service, and strengthening the capacity and the workforce of the organizations involved, and to help build for the future. Academic health department partnerships can look quite different from one community to the next, and there's no one right way to develop a partnership. With that said, there are some basic characteristics that the Council on Linkages talks about as being part of an AHD partnership. So at the most basic level, as I said on the last slide, an AHD partnership has at least one academic institution and one health department working together. As part of working together, there might be some kind of written agreement that links the organizations. It could be a contract or a memorandum of agreement, a memorandum of understanding, or something similar. And through these partnerships, the organizations engage collaboratively in providing education and training to students and to the current workforce. They can work together on joint research projects or will jointly provide public health services. So to accomplish all of this, these partnerships may involve some kind of sharing of personnel, sharing of funding, or of some other resources between the organizations. There are lots of reasons that organizations engage in these partnerships, and I've highlighted just a few here that are more of the common ones. So AHD partnerships might help to enhance capacity and better address community needs. Many academic health department partnerships involve student training through things like internships and practicum experiences, or health department staff providing guest lectures in academic programs. And these experiences can really help to provide students with more practice-based experiences and perspectives, which can help them better prepare for jobs within the health department. These partnerships also support recruitment of qualified personnel, particularly in terms of that pathway from academia into governmental public health, and help to retain staff who enjoy working in more collaborative type of environments. These partnerships also help to facilitate lifelong learning for both practitioner and for faculty. They help to develop and use research that is relevant to practice, because these partnerships bring academic researchers closer to public health practice, and they tend to emphasize more community-based research activities. They are also helpful in maximizing the use of limited resources and enhancing the organization's competitiveness for new resources. And they're also really helpful in meeting accreditation standards, both for health departments and the academic institutions. Ultimately, these are all pieces of a larger picture that helps to strengthen the public health system and improve the public's health. We often get asked how many AHD partnerships there are, and while we really don't know, we do know that collaboration and partnership between academic and practice organizations are widespread, based on data from the Association of State and Territorial Health Officials, ASTO, and the National Association of County and City Health Officials, NACCHO, profile studies. So these data show that the majority of state and local health departments work with academic institutions in some way. So 100% of state health departments work on projects with academic institutions, and 0% report having no relationship whatsoever. Similarly, 89% of local health departments work with colleges or universities in some way, with 64% having regular meetings, written agreements, or sharing personnel or resources, which are some of the things that we tend to associate with having a more formal partnership. So what we don't really know is just how many of these relationships would be academic health department partnerships. But the Council on Linkages has begun documenting these efforts. So we host a public list of AHD partnerships on our website, but we are certain that this does not come close to capturing the true scope of these partnerships. The Council on Linkages has also put together a working model to describe how these partnerships form. This is, of course, a generalization, and not all partnerships will form in this way. But in general, we'll see that AHD partnerships often develop in stages. There can be a natural progression in the early stages. So, for example, an academic program needs student placements for internships or for field experiences. So they contact their local health department to try to get students into placements. Or staff at a health department and faculty and program administrators from the academic institution get to know each other and informally begin collaborating on relevant projects. So these informal relationships often form the basis of the AHD partnerships, with the relationship developing and becoming more complex and comprehensive over time. Even with this model of evolution, one of the reasons AHD partnerships can be so fascinating is that there are simply so many variations of these partnerships, depending on what works best for the organizations involved. And you'll hear some of the differences from our speakers today. AHD partnerships can have different structures. Some are set up as a one-to-one relationship between two organizations. Others are more of a consortium, group, or a collective of multiple organizations all working together. Some are governed by advisory or other boards or committees that steer the overall direction of the group, while others are more organic or free-flowing. Some involve shared staff who work jointly in both organizations, while others have designated staff in each organization who partner and work together to coordinate their activities. And these partners can also involve many different types of partners. Core to the partnership, of course, is a health department and an academic institution, but the academic partner does not have to be a school or program of public health. And there are AHD partnerships that include an array of academic partners, including schools or programs of medicine, nursing, pharmacy, nutrition, public affairs, journalism, urban planning, law, and engineering at all levels. So it could be at community colleges, in undergraduate or graduate programs. And there are also a handful of AHD partnerships that bring in other relevant practice partners, such as hospitals or medical centers. AHD partnerships have different levels of formality that range on a continuum. Some partnerships are informal, others put in place written agreements to formalize their relationship. So these agreements can range from a memorandum of understanding or agreement through to a contract detailing the work that will be done. And AHD partnerships engage in a wide range of different activities, but we usually group these activities into education and training, research, and service delivery. So for organizations wishing to pursue such partnerships, for the last 13 years, the Council on Linkages has provided capacity building support through its academic health department learning community. The academic health department learning community supports organizations working to develop and sustain AHD partnerships, providing an opportunity for people to explore the idea of AHD partnerships and to learn from each other. The AHD learning community has been around since 2011. It is open to anyone who is interested and currently has about 1,500 members from health departments, academic institutions, and other organizations across the country. It offers a way for people to connect with others who are engaged in this work, as well as with tools, resources, training, and technical assistance to organizations working to establish and grow their AHD partnerships. Learning community activities include sharing stories and highlighting AHD successes, webinars featuring AHD partnerships. There's also development of resources such as collection of agreements that organizations have used to formalize their partnerships, and just enabling dialogue and assistance. And all of these resources are freely available to anyone who would like to use them. If you are not yet a member of the Academic Health Department Learning Community, we'd love to have you join us. The AHD Learning Community website is on the slide here. If you'd like to join, it is as easy as letting me know. So feel free to drop a note in the chat or to send me an email. We also have a couple of newsletters that share AHD Learning Community updates. The Council on Linkages has an approximately monthly newsletter, which is the Council on Linkages update, which regularly features the latest about AHD partnerships and other Council on Linkages initiatives. PHF eNews is also a great option. It is our monthly organizational newsletter focused on performance improvement that also shares information about what's new with AHDs. And finally, feel free to reach out to me at any time with any questions, or if you just want to talk a little bit more about potentially starting or enhancing your AHD partnership. So I just wanted to close by sharing a few resources. As discussed, you can find the AHD Learning Community online, along with the archives of our AHD webinar series and other resources and tools related to AHD partnerships. Information about the Council on Linkages in general is also available online if you have questions about that. And we are very excited to share that we have a book that is now available, and may be the first and only book devoted to academic health department partnerships. So we're very excited about that. So with that, I just wanted to say thank you. Please feel free to reach out to me and let me know if I can help with anything. And I will go ahead and pass the floor over to Sarah.
Hi, everyone. My name is Sarah Worthington. I am the Academic Public Health Manager here at the Toledo-Lucas County Health Department in Toledo, Ohio. Next slide. So you can see on this map here, that little red area is Lucas County, which is the entire area that we serve, which is about 426,000 people. We have anywhere between 120 to 130 employees. Prior to me being hired in February of 2022, my position, the processes, and our standing as an academic health department didn't really exist. So I've been able to build everything from the ground up to what it is today. Some of the first goals that I had were to connect with other local health departments, with the academic health departments, to see kind of what they were doing, what was working, not working, and then kind of taking that information to establish us as a formal academic health department and to create a streamlined process for our students and staff. Through talking with the other health departments is how I came across the Public Health Foundation and the Academic Health Department Learning Community, which has been a great help with getting a lot of my programs off the floor. I was hired by, and I'm still solely employed by the Toledo-Lucas County Health Department, and I find this to be really beneficial for us because it allows us a little bit more freedom to work with multiple academic institutes. Next slide. As the academic public health manager, I have two sides to my job. So the first being the student experiences and then staff workforce development. You can see the bullet points for the main activities that I do for each side. The first year, I really focused on the students. As I was able to kind of get a feel for the job responsibilities that I have, I was able to start incorporating our staff into the learning too. I often work side by side with HR and other divisional directors here so that we can see where students are needed, what projects that they have, and locate any areas of training or learning for our staff. Next slide. Here we have one of our health educators, Vanessa. She's teaching high school students on safe sleep. She's doing the crib challenge. So basically, it's a hands-on activity for students. They have 10 seconds to make the crib a safe sleeping area for the baby. This is one of the activities that we do for career events to make things a little bit more hands-on, get people drawn to public health. And this will lead us into the first part of my position, the student experiences. Next slide. So you can see the student experience opportunities that we have here. At first, we started only with the internships. That was my main goal, was to establish a procedure for how we get students into the health department, what it looks like during their internship, and then offboarding. And then the other opportunities really grew from there. During a student's time with us, we try to make sure that they have a chance to see all the others areas of public health, because we have so much at our health department. So they might primarily be an environmental health intern, but they are still seeing the other programs that we have, like WIC, Safe Sleep, that sort of thing. So for a student to complete a student experience with us, they complete an application. And then I meet with every student one-on-one, whether it's virtual, over the phone, or through email. So I can kind of get to know them, what their goals are, what they're interested in. That way I know that where they're placed will complete their hours so that they have the requirements completed to graduate. But also I want to make sure that they are finding what the work that they're supposed to be doing interesting. We want them to stay in public health, not kind of scare them away by doing all of the boring projects. At a time, we usually have between 5 to 9 interns, and we can see anywhere between 10 or 16 nursing students every semester, depending on our needs. We also go out into the community, so whether it's for career fairs or a classroom visit, I make sure that I consult or have that staff who's an expert in that area with me. In this picture, you can see that we were at a career day. So we were requested to go to an elementary school for career day to highlight one of our many positions here at the health department. Mike is one of our registered environmental health specialists, and he works on water inspections. So he is demonstrating to the kids what they do for water inspections and the dye testing. So they were able to kind of see what that water looks like, so that if there's an issue, they can find out where it's leaking, that sort of thing. For other projects, we also can act as a site for students. So we've had a couple of students complete their thesis with us, or if they're conducting research for their graduation requirements, we try to work with all of the students and be as student-centered as possible, because they are wanting to join into public health and we want to give them a good experience. Next slide. As for the data part of my position, I do track all of the hours and outreach that we do have through my program. And I kind of separated them into 4 main areas, but I can go in and break them apart further if needed. So for example, the events and nursing groups, I can go in and see how many nursing students we've had during a certain time period and what schools that they were from. And I can also look at maybe the number of hours spent at a career fair doing education and outreach. Based on these numbers, since I started in February of 2022, we get on average about 660 students per year, and over 2,000 hours completed of education, internships, clinical rotations, all combined. So it's not just like the interns. That would be kind of crazy if we just had 600 interns. So I do kind of try to keep track of everything. And since I am employed by our local health department, it does give us a lot of freedom to accept students from high school all the way up to higher degrees like MDs or PhDs for internships. And then also gives us the freedom to go and visit the younger kids at fairs and classrooms, as little as grade school all the way through college, because we want to be able to start pulling people in to public health at a younger age. A lot of the students that I see kind of really fell into public health, or they didn't really know much about it. Next slide. So through our academic health department, we've been able to promote our programs and services to community members, people currently in the workforce, and then those students who will be joining the workforce soon. A majority of those medical and nursing students we see don't really know about us as an organization, the services we provide, or the resources that we have available here. So after spending some time with us and learning about our programs, hearing our staff talk, or maybe doing those one-on-one clinical hours, they're able to know what we do now. So that way, when they enter the workforce, they have somewhere where they can refer people to if they're looking for a specific service or they might not have health insurance, or they might be low income. They know where they can send them. In addition to not putting those limits on the age ranges, we also don't limit accepting students from our immediate area. So you can see this map here. We do accept people from any of the schools. I work a lot with them, and most of our students do come from our area of Northwest Ohio. As that key person for maintaining our relationships with these different academic institutes, I do a lot of the legwork for our academic agreements and MOUs. So we do have 12 agreements right now with out of the 28 schools that we do work with. I kind of vet them before I send them off to our grant coordinators, make sure that they have everything in there that we need, so I know it doesn't get rejected by our legal department. They will then send it off to our Board of Health for review and approval, and then our health commissioner can finally sign off of it. And I will then work with the school to kind of get that fully executed and make sure I get a copy for our records. Since I am that person doing most of the legwork, I also make sure that I make note of those expiration dates. So that way, if there is one, I know when to start working on that renewal process, because it does take a little bit of time for us to get it through legal and then our Board of Health. Next slide. So I would just like to highlight some of our student successes. So Nicole here, she was one of our injury prevention and harm reduction interns. She worked under our naloxone health educator. She was with us from October of 2023 until April of 2024, and she completed 300 hours. It's really interesting to see our students come to us and watch them grow, not only in what they know, but the confidence that they have in themselves as well. She spent a lot of time out in the community building those relationships and her public speaking skills. She taught a few groups of our nursing students about opioid awareness and when and how to use naloxone. Since she has completed her internship with us, she has graduated with her bachelor's in public health with a pre-med concentration and also with a minor in chemistry. Just last month, she was a co-speaker with me in the Public Health Foundation for the Division of Workforce Development Science and Learning series. So now she is continuing her education. She is a fellow at Ohio University, and then she plans to go even further in osteopathic medicine. Next slide, please. Next, I want to celebrate Tara. She interned within our WIC breastfeeding support program under one of our registered nurses. She was with us from September of 2022, and then she completed 500 hours for her certification in October of 2023. So she was with us for a very long time. In addition to that, she stayed with us until April of this year so that she could get more experience to take her IBCLC boards. And she let us know recently that she has passed them. So it's very exciting. It is a very hard certification to achieve. Next slide. A little bit more broadly, some of the other work that we have been able to get done because of our students include a fetal and infant mortality review, or FEMR, policy operating guide. This guide is now nationally available on the National Center for Fatality Review and Prevention's website. Because of this guide being a national resource, our internship supervisor over the student who helped complete that guide was asked to become a mentor for new FEMR program coordinators. So we're seeing that we're able to complete something here with our interns and our staff that we wouldn't have the capacity to do before. And it's going even further to help the capacity of other health departments and programs at other places. Next, with our social media constantly changing, we had an intern who was doing her bachelor's. She was able to help us get a fresh look at how to reach younger audiences, as well as using those methods and social media trends to really get our views and impressions and interactions up with new awareness campaigns. Right now, We have interns that are actively piloting a new platform for case management services within our Healthy Start program that could simplify a lot of things for our staff. We are also actively creating different dashboards to easily get information to help us make evidence-based decisions and evaluate our work within maternal and child health and our environmental health programs that we would not be able to do without those interns. Next slide. So next up, I want to touch on our workforce development efforts, where we look at helping staff with learning and professional development opportunities. In this picture, we have Joe, our naloxone health educator, who Nicole interned with, and Taylor, our Ohio Equity Initiative coordinator at a grant writing workshop. So I assist in coordinating trainings like this and work with other staff to find other potential opportunities that could be beneficial for our staff or our organization. Next slide. One of these big programs that we have right now is Tech Cred. So this is a reimbursement-based grant from the Ohio Department of Development. We are able to get our Ohio staff signed up for courses that might help them perform better in their positions. Many of our staff take courses on Microsoft applications like Word, Excel, and then other stuff like Tableau, ArcGIS for EPIs and our environmental health specialists. And then we even have people taking IT management and leadership courses. With this grant, we have been able to help 54 staff earn over 160 certifications worth almost $60,000. So this is a really great thing that we have been able to invest in our staff here because of our program. So once an application is approved and awarded, all of those courses are scheduled individually by each staff member so that we know it can fit into their schedule, and they are all currently online too. Next slide. Sometimes when a grant or a scholarship is offered, that info can be sent to me to look into and coordinate. So that happened quite recently. We were awarded a scholarship from NACCHO this year for local health department staff to become certified in infection control. This scholarship covered 4 staff members to study and sit for the CIC exam. And so far we have had 2 people successfully pass and become certified. Also, a few times a year, I coordinate with Grant Writing USA to host grant writing and management workshops locally. I will distribute that information to our surrounding partners, and we are able to get seats for our staff to take the courses. They are 3-day workshops that are in person, and we usually have about 20 to 30 people in our area join. We've even had a few people come out of state to join these courses. But it is really important for our staff to learn how to locate grants, how to write for them successfully, because a lot of our own staff write their own grants for their own programs, and a lot of them don't have that formal training. But because of this, we've had 8 staff be able to take these workshops and gain that knowledge. Next slide, please. Another program that we have for our workforce development efforts is our learning management system platform. So this hosts a lot of trainings for our employees to take. Most of these courses are optional, but I have found that a lot of employees will take advantage of this even if they're not required to take it. I have noticed that our staff really have that want to learn more. Some of these courses that they can take include trainings on topics under business and soft skills, like conflict management, communication, and as well as health, safety, and wellness courses. And we even have some courses on IT and data. We also use this LMS to assign our required annual trainings, and it has helped our HR office so much with tracking these certifications, making sure that we are compliant. And we also use it to streamline our onboarding process for new hires. With this platform, we are able to create our own trainings as we see fit, track that training data, and see what kind of trainings our staff are interested in taking, what they're completing, what they're kind of starting and stopping, and we can get that feedback additionally as well. Since implementing this in April this year, we have had 537 trainings completed. Next slide. The last program that I will talk about is our tuition reimbursement initiative. So this is a program ran by the Association of Ohio Health Commissioners, and it was made possible through a grant received from the Ohio Department of Health, utilizing those workforce development funds from the CDC. There is a $10,000 maximum for each person, but 13 of our people did qualify for this program, and we were able to get $64,000 reimbursed directly to our employees. A lot of these degrees consisted of public health, but we even have some who did nursing, anywhere from RN, BSN to MSN. And then we even had a few of our staff members. They were able to earn their registered environmental health specialist certifications. Next slide. So throughout our students here, since my program is still so new, I am working out what I need to track. At the end of a student's time with us, I will send a survey out to see how we're doing to both the student and then whoever was supervising them during their internship with us. I would like to share some of the feedback that we have gotten from our students and then one of our staff members that kind of shows how my program, our academic health department, has impacted them. Next slide. So one of our childhood wellness interns said that having one person from our organization to help them get that agreement completed helped her so much. The process for securing agreements is already very complicated, and she didn't have to worry about being that middleman between the university and the health department. And she could just focus on her internship so that she could meet her requirements to graduate. Next slide. One of our environmental health interns was interested in both epi and environmental health. So although she was only an EH intern, she still rotated and saw some of our other programs, which included epidemiology. And because of that, she knows that she would continue pursuing that route of epidemiology. So we see this a lot where our students are kind of unsure about what they want to do, and their experience with us helps them make that decision. Next slide. A nursing and clinical services intern said that she didn't realize how big the field of public health is and how much of it is really behind the scenes work. So this has brought her a better understanding of public health as a whole and how it affects a person. And this will definitely help her in her goal of becoming a doctor in the future. Next slide. So we have medical students who rotate throughout our entire health department. One of them was able to see the other side of healthcare as opposed to that direct care. So he actually went out with one of our registered environmental health specialists, and they were doing home visits, and he was able to see firsthand how a person's environment can contribute to their overall health. And that will help our doctors a lot in seeing beyond the doctor's office and what else can affect them in their health. Next slide. One of our childhood wellness staff members told us that at the beginning, her intern was unsure of what she wanted to do after graduation. But because of her time with us and how we ensure that students have that chance to rotate throughout our health department that aren't the primary focus of their internship, and talk with our other staff, that she will be applying for her Master's of Public Health with a focus on epidemiology. Next slide. So I would just like to say that students are the future of public health. They are our future. And through academic health departments, we are not only investing in the next generation of our public health professionals, but we also have a chance to improve our current teams by including our staff members in these. By supporting that student engagement and workforce development, we really are fostering a workforce that is confident and competent, all while building those relationships with our academic partners and strengthening our community. All of these things will help us with our overall capacity to complete our visions and missions set by our organizations and make those meaningful impacts in our classrooms, our workplaces, and our communities as a whole. Next slide. So thank you guys all for being here and listening. I will now pass it over to the Academic Health Department at the Massachusetts Department of Public Health.
Thank you so much, Sarah. It is such a joy to hear everything that is going on in Toledo. I really love learning about your programs and especially the testimonials. I think the experience for the preceptor and the student, it can have such like a big meaning. So thank you for sharing, and thank you all for having me. I'm shocked there's 208 people on this call right now. It's a Friday. Wow, it's wonderful to be here. So my name is Beluk. I am the Academic Health Department Manager for the Department of Public Health in Massachusetts. If we move on to the next slide, we are going to be talking about a handful of things today. We just had the pleasure of learning about the Toledo Public Health Department, and now we're going to be taking it up to a state level. So our objectives for my portion of this presentation is I'm going to describe a little bit about the Massachusetts Department of Public Health, give you a bit of an origin and the timeline of our academic relationships, and then I'm going to go into 4 of our academic partnership agreements that we currently are working on. So let's dive into it. Next slide, please. All right, so the Massachusetts Department of Public Health, we have approximately 3,200 employees working all throughout the Commonwealth of Massachusetts. You can see here the Academic Health Department. We have this little red box in the Commissioner's office. That is where we are located. We're there with the General Counsel, the Communications Office, and though we're not directly working with specifically just workforce development, you'll see we're under the Commissioner's Office as well. So along with all of our bureaus and offices, we do have 4 public health hospitals throughout the Commonwealth, and that makes up almost half of our workforce. And those are hospitals that are really taking patients that nowhere else in the state does. So this is an overview for some more information just on like the context of Massachusetts. We are decentralized, and there are 351 communities with local boards of public health, and 51 of those organizations or local boards have shared services. You'll see we also have a little box over the Office of Population Health, and we're going to talk about one of the programs that they run a little bit today. So you can take a look at this. You'll get all these slides later. Next slide, please. So the way that the Academic Health Department communicates, you can see I'm at the very far right-hand side of this little org chart, and I report to the Deputy Chief Operating Officer. And my role, you can see we have 2 large programs, the preferred partnerships, and then we have an internship program. And then my role as the Academic Health Department Manager is to communicate with the academic partners throughout the Commonwealth, and then take that information, communicating it with DPH staff across the bureaus and offices, and vice versa. So listening to them and making sure I'm sharing it with the academic partners. So that's a little bit of an org chart on how it goes, but I'm essentially a bridge communicating all of the information going on at DPH and then the information going on with our academic colleagues as well. Which brings me to my next slide. When we think about Massachusetts, we have about 144 colleges and universities throughout the Commonwealth, which is pretty remarkable. We have wonderful institutions, and we're working really hard to be making sure we're communicating not just with the public health schools, but with the institutions and organizations throughout the whole state. So next slide, please. This is a little bit of an overview of the timeline of the academic relationships that Massachusetts Department of Public Health has had. When you think of Massachusetts, I think you can really think about a lot of the history and the institutional relationships along with it too. And there have always most likely been relationships going on with the academic institutions here since the beginning of the Department of Public Health. When my colleague did an environmental scan a few years ago, she was able to see everything dating back from the 1980s. And it really started with internship programs, professional development opportunities for conferences and staff. And then as we move on throughout our timeline, we see that there's a lot more collaboration going on at the state level with research. So for example, when we look at the little orange square, that it would be the MassBrit, which is the Massachusetts Screening, Brief Intervention, Referral, and Treatment Program. And it was a clinical service that utilized specially trained health promotion advocates to universally screen and help patients with risky or unhealthy and alcohol and drug use through brief intervention counseling that facilitated referrals to specialty addiction treatment. So what that looked like was Boston University collaborated with the Mental Health Service Administration and the Massachusetts Department of Public Health in looking at this research and then creating a program that was then implemented in Boston Medical Center. And they contracted to implement the program from 2006 to 2012, which is really exciting. So when we move on, then we kind of see some more partnerships of how the state is working with these schools. In 2010, one of the larger ways that the DPH was collaborating with academic institution would be through the local public health institute. BU did a wonderful job kind of facilitating the trainings for the local public health on their online platform, and they were able to facilitate resources for that part of the workforce, and that ran from 2010 to 2023. You can also see in the 2010s, DPH was advising medical schools on core competencies for prevention and management of prescription drug misuse. We also formalized our internship program in 2016, and the Public Health Data Warehouse launched in 2017, which I'll dive into a little bit later. In the 2020s, that's where we are now, we're going to modernize our internship program, and then we began a paid internship program in 2024, and I'll talk a little bit about that. And I think it's probably helpful context. My role, I'm the first person to have the role as like academic health department manager at the state, and I started last May. So there's been all of this great work going on, and then my role is really helping to kind of continue to organize all of the wonderful work going on in Massachusetts while also amplifying it. Next slide, please. One of the most exciting parts of our academic health department would be our academic health department consortium. This is a group of 8 different schools that have public health programs that we partnered with. Back in 2019 is when it was originally formed. The schools, one of the schools actually came to the Department of Public Health, and they were really interested in getting this going and lifting it off the ground. And with their support, they were able to connect with the other organizations you see here to really kind of think about what a good partnership would look like, how could we move forward as an academic health department, and what were some initial goals that we wanted to accomplish. Unlike or rather I should say, we don't necessarily have a formal agreement with every single one of these organizations. The goal when this program initially started was be able to be working together seamlessly and focusing on collaborative approaches to some of the challenges they were facing. And so while there isn't a formal agreement, it was very intentional, but there were goals that were written out that first year. And a lot of those goals that the consortium agreed that they wanted to focus on was communication and making sure students had a better idea of the opportunities at the Department of Public Health, and that the schools were also able to share their opportunities with DPH staff. So 2019 seems like forever ago, I feel like, in the public health world, especially when you think of the pandemic. This consortium was huge in the Massachusetts response for the COVID pandemic. They really worked very well together to organize and get all of the contact tracing going on in the state, and we're really critical with finding those volunteers. So we are at a place now with this consortium where we need to revisit our goals. 2019 was a while ago. I now have a position to help facilitate all these awesome relationships, and we're really excited to kind of bring everybody back together, reflect on what we've accomplished, and kind of look forward on what we want to do next. Next slide, please. All right, so the preferred partnerships. One of the ways that the academic health department for DPH is really involved with employees is ensuring if they want to go back to school to get their education, we have some opportunities that they can do so. So Boston University School of Public Health, Springfield College, Walden University, and Chamberlain University are some of the academic institutions that we provide discounts for, which are really great, and that's available online on our internal employee website. And then along with that, I don't necessarily oversee this program, but I do try to promote it as much as I can. All Massachusetts state employees are eligible for tuition remission at a state community college and university. So if you go to the next slide, you'll be able to see all of those schools. I know there's like so many wonderful things, like I want to get another degree just looking at this list. All right, next slide. Okay, so we've talked a little bit about how we're supporting employees, some of the larger overviews of our relationships that the academic health department has with schools. We're going to shift gears to talk about the public health data warehouse. This is that organization that I said was in that other little red box when I started speaking in the Office of Population Health. The public health data warehouse was authorized in 2017 during the annual state budget process to amend Massachusetts general law. The amended law, it allows the commissioner to collect, record, and analyze data, as well as assemble and maintain data systems necessary to analyze population health trends. The commissioner made it a prioritize to analyze fatal and non-fatal opioid overdoses, as DPH determined key questions could not be answered without linking the data sources. So the public health data warehouse allows DPH to look at specific questions they're interested in answering by grouping the relevant data points together. And when we look at that data collectively, we're able to capture a much better picture of the specific risk factors or challenges that can inform targeted and tailored approaches to addressing those problems. Next slide, please. All right, so through data access agreements, there are 26 individual linkable data sets, 19 community level data sets, and 4 lookup tables. This leaves us with about 5 billion records from 38 sources, which is way too much information for DPH to analyze on its own. So this is when the partnerships with the school comes into play. The public health data warehouse will then release a notice of interest to the academic and medical centers, and academic institutions are then able to respond in order to obtain the data for their studies. So as I mentioned, all of these data requests must advance the public good, and DPH approves each individual data request. There's really strict guidance in involvement in DPH sharing its staff. And again, like DPH is really steering this, but the academic partners are helping to kind of like facilitate the research and may have the infrastructure capacity to continue to do so. Moving forward, next slide, please. You'll see that we have public and private partners that are working collaboratively. We have 33 academic institutions. All of this is online at the Public Health Data Warehouse. And some of the strengths, I think, that the Public Health Data Warehouse shared with me recently is that this data set that they have, that they oversee, is being recognized as a really wonderful data set by NIH grants. So when institutions are citing that they're using this data set, they have found that it's like a green flag on their application. For example, Boston University, they were awarded $89 million over 4 years to reduce opioid overdose deaths by 40%, and that was an NIH grant. So it's great to see that like the Public Health Data Warehouse is really becoming a reputable source. Next slide. Awesome. So this is another way that we're kind of helping to inform academic institutions in partnership. So this is just one example. You could have like a 2-hour presentation on the Public Health Data Warehouse. They're really doing great stuff. But this example highlights some impact that the research that the Public Health Data Warehouse had specifically on medical school curriculum. So as you can see, individuals who received medicine after a non-fatal overdose prevented mortality. And that this research allowed direct action to fund clinicians, provide treatment, and change medical school curriculum to continue more research, which was really important as Massachusetts continues to address the opioid epidemic in the country, or specifically the Commonwealth too. So that was a little information on the Public Health Data Warehouse. We're going to shift gears now to talk about the internship program at DPH. We go to the next slide. All right. a bit of a pivot, but we can handle it. So as I mentioned, we do believe that there have been interns at DPH for a very, very long time. However, it wasn't until 2016 where we started collecting that information. And as you can see, this shows year by year how many preceptors we've had, how many interns we've had. And at any given day, there's probably been about 21 interns at DPH since 2016. Now, what happened, how we started collecting all this, the academic health department, one of the first things that they established was creating a form, a red cap form that could then collect all of the information about the schools, the majors, what bureaus and offices were hosting interns on a semester or a yearly basis. And with that information, I've been able to then go in and improve systems and think a little bit how we can be more strategic with the development of our programs and our outreach so that more students are aware of the opportunities that we do have. Which brings us to our next slide, which is the public health, the public health infrastructure grant, FIG, the paid internship program. So Massachusetts was a recipient of the public health infrastructure grant, and as part of that grant, we are funding some of our interns, and we have a couple of goals with the program. We started it last March, applications went live, but we really wanted to learn about the systems within the department on how to host an intern, from the intern experience as well as the preceptor experience. And by able to get all of that information, we're hoping we can then grow the internship program so it can become something that individual staff members can be self-sufficient in doing and run on their own. So we are hoping to learn a lot about the systems in this process, as well as learn about what schools need and what their timelines look like. So for an example, just a quick anecdote, when I started last year, I was trying to get an intern a laptop. I was like, they're working with confidential data. This seems like a really good use of making sure a staff member has a laptop. And people were like, no, they can't have laptops. And so I was like, could we ask though? Could we follow up? And like, we're just kind of like asking questions of this big system that we're in. And lo and behold, interns actually are able to get laptops. And it was just kind of something that they thought might not have been true. So I think sometimes going through the process yourself and being willing to ask the tough questions in a really large bureaucratic system can be really helpful, and not everyone has the time to do that. So if I, as someone who is working with students and trying to make this experience easier for staff as well as interns, can ask those hard questions, we can improve it and have more interns overall. So though we are funding paid internships, the goal was really to have this like deep learning experience as well, to include some performance management along the way. So we ended up having 16 projects. They span 7 of the 14 bureaus, and they range in a bunch of different fields. It's not just public health. We also have folks working in the legal and the communication field as well. So we can move on to the next slide. So with the public health infrastructure grant, we're able to host 18 interns this current fall. They're all working in these following bureaus and offices. And then we're also able to fund my role, a program coordinator, and we've hired a 6-month co-op who is able to oversee this internship program. Next slide, please. All right, so what's next for our paid internship program? We have everyone here, which has been wonderful. I think we've learned a lot about the systems, and as we continue to look ahead, we're hoping that we can create professional development opportunities. I think we're trying to be very mindful about how learning is different from the student perspective in a hybrid world. You don't necessarily have the water cooler coffee chats with people. So how can we make sure we're cultivating those experiences for students virtually? We're creating an end of semester showcase, so more staff are able to see the wonderful work students were able to accomplish, and then also show them all of our new systems of how they can onboard interns with the support of the academic health department. If you're in the Massachusetts area, it will be December 5th. You are welcome to join. Along with that, we're going to be taking what we've learned so we can develop internship orientation specifically for students who are working with the state. The state orientation, it's a fine orientation, but it covers a lot of information that isn't really relevant to a student. So how can we make sure that we're gearing this towards student experience and talking about the goals that they may have? We're working on creating that guidebook so people can independently at the state work on developing their own internship program and may not need our support if they don't need it. The other things we are focusing on doing are defining goals for the next FIG funded internship and we're gaining feedback along the way to ensure that we're thinking really strategically on how we would like to structure that. Next slide, please. So it's not a one size fits all approach. I think you've heard a couple of times, like I'm really working on documenting the systems on how you can find an intern at DPH, because with over 3,000 employees, not everyone wants to have an intern at the same time. The needs are different. And though I'm hosting paid funded opportunities, you know, that's at one semester. So it's important that we are a resource hub for these preceptors. There is also another thing to kind of realize as the academic health department manager, that there are a couple internship programs in our Bureau of Infectious Disease and Laboratory Science and our local public health epidemiology that host a really wonderful program. And how do we continue to amplify and work with them while not trying to say like, this is the only way forward. There's a lot to learn. And the more we connect as a resource and a support and a guidance and like showcase best practices, people can come to us to learn and to grow. But it's not necessarily like a mandate for every staff at DPH who wants to work with interns. I don't think it would fit the culture very well. And one of the things we have to do is just to continue to promote ourselves and get ourselves out there so people are aware that we exist and really can be helpful. Next slide, please. Here are some ways just to wrap up of like the essential components of the academic health department and the collaborations that we've had with some of the universities hosting career events and then also bringing students to specific laboratories. So we're really thrilled that we've had so many like wonderful things going on and we're looking to continue to grow and are excited about what the next chapter has in store. Thank you. I'll pass it back to whoever has the mic next.
I think that would be me. And thank you all. Wow, what a great session. Sarah, Chrissy, and Myella, thank you. We are ready to take questions from the chat and from the floor. Put those questions in the chat. We'll address as many as we can as they come along. But I know other sessions, Ron, you have been keeping track of some of the more critical questions out there. So maybe you could kick us off.
Well, there were no critical questions. They've been very complimentary, Carol. Sorry. So, Sarah, you've answered a variety of questions. Thank you in the chat. But there are a number of questions about internship programs, and they were initially for you, Sarah, but I think they apply both for you, Sarah, and Chrissy. So let me ask several of them at once. So, you know, what does recruitment of interns look like? When interns come in, do you have other staff who work with the applications? And I suspect it's very different in Massachusetts than in Toledo-Lucas, because Sarah, I get the sense you are many people within your health department. And how do you recruit? How do you look through the internships? The distribution of students, MPH, nursing, undergraduate, engineering, and then, excuse me, how do you engage your staff in working with the interns? So let me throw it out to, well, I'll start with you, Sarah. Chrissy, give you a little bit of time since, you know, Massachusetts is complex too.
Cool. Okay, so most of our recruitment is done virtually. We usually do not have to advertise for our openings since we have a lot of students and universities near us looking for internships. And through our students, I've heard that it's been quite hard to locate an internship at this time for public health. I am the point person for all things students, so I handle everything from that application to placement. If somebody reaches out directly to our staff for an internship, they direct them either to me through the phone, email, or to our website. I have a whole webpage for student experiences that gives them all the information. There's an application if they want to do any of our student experiences, as well as a question box. Those all get sent to me in my inbox, and I will answer them or contact them back to follow up or to review their application for placement. Once I kind of get those applications, I'll talk to our different positions, our departments to see who's in need for an intern. If somebody is coming to us requesting an EH internship, but we already have 1 or 2 students there already, I'll kind of talk to them and say, what are your other options? Are you interested in anything else, to kind of place them somewhere else that we do have an opening, as opposed to just saying, sorry, no, we don't. With one person handling all of the onboarding and offboarding, it's a lot easier to see how many interns we have in one place. We are a very small health department compared to Massachusetts, so it's a lot easier for us to manage. I just have everything like on an Excel spreadsheet for all of my different student experiences. As far as that goes for different ones, a majority of our internships are bachelors, and then our other ones that are grouped together, like the PhD, MD, nursing students, that sort of thing, and then our master's program. So I think they said that the master's program they guess would be the most popular. It's actually our bachelor's. So only a little bit are public health. So out of the 47 that we've had for our bachelor's internships, about 14 of those have been public health. I
So-
don't remember what the other question was.
Well, that's okay. I'll turn it to Chrissy at the moment, and then we can come back to other questions.
Sure. So I would imagine there's a lot of organizations, a lot of public health departments who might be in a similar boat, but the request and ask for an internship far outweighs how many internship opportunities that we have and could offer. I think every day I probably get a couple of emails from students, and it can be overwhelming. I think when I first started, I was shocked with just how much interest. You go back to that slide, Massachusetts has 144 colleges and universities. So the paid internship program that I'm hosting through FIG is an opportunity for students to apply. We make sure the timeline is really public on when those applications are going to be live, what that cycle looks like. We have a really wide variety of opportunities. And then we have summer internship programs. But other than that specific experience where I'm managing the application, it's based off of the bureau or office. And one of the things I'm trying to do in the academic health department is make sure staff members know that we can help promote opportunities. I think one of the big things that Massachusetts is really focusing on right now is equity. And for me, that comes down to making sure people are aware of these opportunities. So it doesn't just go to someone who knows an alumni of their program and whatnot. So the paid internship program is really nice because it's online and it's public. We promoted that through Handshake, which is, if you're not familiar with it, it's almost like a student version of LinkedIn. And that was a really robust way. For the paid internship program, we did direct outreach to every community college and state college in Massachusetts, so they were aware of it. And then we made sure we emailed all of the colleges and universities along with our consortium that we talked about, so people were aware. We had about 500 students apply. I think there is a huge interest in public health, which is really wonderful. And I'm hoping that by continuing to showcase the work of students and continuing to promote it throughout the department, more staff will be willing to think about hosting and thinking about projects that might be really valuable. I would say a majority of the students that work with us are completing their master's degree. And though some of them are, may not be studying public health, I would guess without looking at the data that most of them are studying public health right now.
Thank you both for that. I'm going to interrupt Ron just for a second. Mayela, so there's a question in the chat right now that says, for those of us who are from small states without dedicated academic health department staff, is there a place, or do we all feel there's about the amount the most important place to start, knowing that we may not be able to grow as big and as fast, based upon the tools that you all have with the Academic Health Department learning community, is there a place for them to start using one of the tools?
So I would say you want to maybe start with identifying needs, or maybe some of the kind of like low-hanging fruit for partnership. We are currently working on a project with a local health department that wants to start an academic health department partnership, but they're kind of unsure what to do, or you know, where to begin. And so we are doing some interviews with some of the academic partners in their area to get a sense of, you know, what are the needs of kind of like, you know, the big institutions, or like the smaller, kind of more, I don't think we have any community colleges, but just the different needs of the organizations in your area. Because that really is the place where you can determine what is the mutually beneficial thing that you can do together. And so I think, you know, when we look at the continuum of academic health department partnerships, a lot of them do begin as kind of these informal conversations around, you know, I'm interested in this and you're interested in that, and how do we work on this together in our area? And then I think just a lot about what we've learned in the last few years is that the student experience type of stuff is a very easy kind of like foot in the door to get academic health departments started. So as far as tools, Carol, to answer your question, I can go looking for the link for our like resources page. But I think it might just be helpful to look through some of the archived webinars that we've done before, because truly every partnership is so different. So it might just be looking through that list will give you some ideas of like, oh yeah, like I can probably do something in that area. So I'm gonna go find that link, Carol, and drop it in the chat.
Thank you, Mayella.
Yeah.
Ron, back to you.
Okay. Well, you know, we could ask Sarah and Chrissy if they want to chime in on that question as well. And, you know, again, there's also the stages of academic health departments that you don't have to start at step one, but, you know, that can provide some guidance too. But, you know, Sarah, Chrissy, any additional thoughts?
Since we are a smaller health department here in Ohio, one of the biggest things I had when tackling this myself is I had to taper those expectations of those around me. Everybody was like, oh, you just can do all these big things. You won't have any issue with the growth, but it really is that slow and steady wins the race. I started out with those universities near us. They had a need for nursing students to go and do rotations because it was toward the end of COVID. People were still very hesitant to take on those clinical students. So we agreed to kind of host at least some of those, and it just kind of built up from there. And I was talking to the advisors of the other program. I just kind of gave them my information like, hey, I just wanted to let you know that I'm kind of the new point person here. If you have any student needs, and really just everything grew upon accepting those nursing students.
And Chrissy, anything you want to add to that? You don't have to.
I think the one thing I'll add is the schools that we work with are wonderful and they are so excited to support. And I think I have found they are really looking for experiential learning opportunities. And at Massachusetts, it is such a big department that really figuring out what are our needs, where can we, you know, there are so many students. So I have been really interested in how this past year I've spent a lot of time just working internally on how to navigate our own internal systems so we can communicate them easily. And I do think, though it's a little more labor intensive, I do think it is really important, and the clearer we can communicate to our academic partners, the easier it'll be for students, which is important. So that organizational piece has been really helpful.
Great. Well, I'm delighted to see a comment in the chat that somebody's looking to take the information that they're gathering here from these presentations to be able to use, go back and retry. Because sometimes, it doesn't work the first time, the second time, the third time. And perseverance often helps, and also finding the right champions within the organization. Because we're so action oriented here, I'm going to skip over some questions and ask. This was mainly geared towards you, Chrissy, but Sarah, you may have some thoughts on this one too. And it's about whether or not you have a mentoring program for the staff wanting to work with interns, and how do you sell this idea within the organization? The person who asked the question said, we've struggled with this. Leadership is not always on board. So maybe, Chrissy, we could start with you, and then Sarah, you could chime in.
It is difficult, right? Like selling an intern sometimes, I think I've been really meaningful going into these new spaces and talking about the type of student experience we're trying to host. I think I have a whole slide being like, these students are not fetching coffees, they're not making copies. Like, this is a really collaborative learning experience. And being upfront about my expectations about programs that like our department is going to fund for the internship. I think we're 1 year and change into me being here, and I think the ways that we've been trying to grow the preceptor experience so far has been, one, hosting opportunities on how to like really be a preceptor for students, and offering trainings for staff members so they can learn a little bit about what are best practices. I've been having a lot of conversations about intergenerational communication and what that looks like. Gen Z is communicating very differently than a lot of our workforce, and how can we make sure people are just aware of that and having conversations. So offering trainings to staff so they don't feel like they're alone in the process, being there as a way to say, if you would like to have a conversation or problem solve, or offer those sort of supports throughout, just being a resource. And then I think the other way we're trying to bring staff on, as I mentioned, everyone, I'm going to invite you all. I don't know if I have the authority to do it, but this December, we're really trying to showcase the student work. So along with having a student on my team who's helping facilitate and really contributing to meaningful work, I would not be able to run this program without them. Showcasing just how incredible of an impact it can be and how fun it can be too. I think a lot of staff really enjoy working with students in that capacity. So we're going to try to show it off in a new fun way at the department. So I'm hoping the expo will be helpful for students to reflect on their experience, gain those professional development skills about talking about these opportunities. And then I'm going to have a table that will show staff. I'm like, all right, how can you get this? We have one option, but there's a lot of different things they could choose off of a menu. So those are some of my ideas, and I'll let you know if they work.
For me, when I first started, I was coming to a brand new organization. Everybody had been here for a lot of years. They were just coming out of COVID. So when I first started, I made it a priority to meet with all of our staff to kind of learn more about their programs, what work they were doing on a daily basis, and to kind of get a feel for how things were before. Through my meeting with everybody, I learned that they had not great experiences with students because there were no processes put in place. So to kind of sell that idea of bringing students back in, because a lot of people were so hesitant, we did a QI project to create a whole procedure policy surrounding our students. From there, we took those who were really excited about finally having students back, because we did have a couple. We had maybe a good handful. And we placed a student with them as kind of a pilot to test out our new process and to kind of tweak it as we went. Once people started seeing that having my position really made that whole difference, because I'm here to take care of that back end admin stuff. So I'm taking care of all the paperwork, the onboarding, the training, making sure that they are compliant. they could really focus on that core work of actually completing the internship instead of having to worry about all of those other deadlines. So once they kind of saw that, we had the most hesitant department to hop right on, and they're like, we want interns, and then we immediately got them too. For the training for our staff, in addition to that policy and procedure, I have like a PowerPoint that staff can click through, and then I also made a fact page for those questions that people might not remember if they only have an intern every once in a while. So like, what do I do if I want an intern? What do I do when they're coming up finishing? All of that stuff that they can easily reference if they don't want to go through that entire training again.
So Sarah, there were some questions in here about whether you'd be willing to share any of those slides or any of the guidance that you've developed.
Yes, I am more than happy to share any and everything that you might
Well-
need. Just send me a quick email and I can shoot off whatever it is that you need.
Well, and if you would be willing to share with us, Sarah, we could actually put it up on the website
Yes, I
if
would be
you
more than
have permission to do so.
Yes, yes. My boss is all for sharing the wealth. I mean, it's all built on from what other people have shared with me. So I just want to keep the
Great.
education going.
Super, super. And here's one for both of you again. There have been questions about impact. And there's some research that we know that's done through academic health department partnerships. There's service, there's training, there's a whole variety of things that occur. And I'm wondering if each of you might be able to point to one or two impacts. We also saw, we did a whole webinar on COVID-19 and the contributions of academic health department partnerships to being able to respond to the pandemic. I know Massachusetts, gosh, you had what, 2,000 or so students engaged with. So maybe if you all could talk about any impacts that you've seen.
I know when we were in the beginning stages of COVID, this was prior to me being hired here. They had an agreement with our Department of Public Health for our masters at the university and the health department. And they actually took public health students to help with those contact tracing efforts. So we had pretty much everybody in my class who was available, who was in need of an internship because they couldn't find anything. They were able to get trained on contact tracing, complete those hours, and then they even continued past those. And some people went on to get hired from those contact tracing efforts.
Great. And Chrissy,
I think the first thing that comes to mind, as well as the contact tracing efforts that happened in the pandemic, which was before my time, but it really did seem like it was truly like impressive how quickly all of those universities mobilized. Anyone who's familiar working with a large institution knows just like what a big feat that is. I think that's a big pride and joy. And I think since the pandemic, there hasn't been a single area or topic where our consortium has come together. And I think there is so much incredible work going on, from, the impact of students choosing careers in public service and public health. I shared a little bit about the public health data warehouse they're working, and the relationships that they have with academic institutions from a research capacity. I think I'm realizing, like, in this conversation, like, I wish I had a huge staff to help like measure some of this impact. I think that's one of the harder things on being like a small and very small but mighty team. You need some more people to kind of like help measure everything going on.
and that's actually sometimes where an academic partnership comes in, where a project can be to measure, establish some targets and measure along the way as well.
Definitely.
A question came up about, Chrissy, I think you talked about that you pay interns. Sarah, I don't recall if you're able to, but the question is, how do you pay them? Like, where does the money come from?
Oh man. So what
Not
about
how much.
Well, no, that's public too. We try to be competitive. So the program that I am running is like through the Public Health Infrastructure Grant, which is FIG. There are a couple bureaus and offices. So the Bureau of Infectious Disease and Laboratory Sciences, BIDLS, over the summer, they have it like written into their budget. So we have funding currently, and I think one of the hopes is that we can use this to showcase how like meaningful and impactful interns are, so that other bureaus and offices then write internships into their budgets for the upcoming years. I would say a majority of the internships at the Massachusetts Department of Public Health are unpaid. And if they are unpaid, students have to be receiving academic credit in order to participate in them. And we're, I think, striving for a way that we can make sure all internships are paid to some capacity, and that goes along with our equity values.
And Sarah, I don't recall about paid internships.
All of our student experiences at our health department are currently unpaid.
Yeah, I seem to recall you saying you really would like to be able to figure out how to pay.
I am trying to get things in order and talking with local universities and our health commissioner to try to move for paid internships to be competitive.
Great, great. Mention it, Mayella did mention the book. We don't get a commission on it, but a lot of there are several case studies in there, stories and sort of how-to types of things in there. And I'm just putting that back in the chat here for anybody who may be interested. It's new. We just released it in September. A Labor of Love. So Sarah and Chrissy, I'm sorry, Carol, I should be turning it back to you, but I'm going to ask Sarah and Chrissy if they have any sort of parting comments that you'd like to leave.
Really just take advantage of the resources that are available. The Public Health Foundation and the academic learning communities have so much on there. And they really helped with getting everything set up. I started with their list and reached out to other health departments who had these types of things going on, and it really hearing their perspective of what worked and what didn't work and things that I didn't have to reinvent the wheel on helped so much.
I love that. I think one thing I'll say is working at such a large organization and being this like a small team, I think it's sometimes helpful to hear like, I'm not able and I'm not working on all of the things that our academic health department can do every week or every day as much as I would love to. I think it's okay to really focus in on one area and try to do something really well first, and learn and grow and reflect, and juggle the balls as they're needed. But I think there is so much potential with academic health departments. I find it a really inspiring role and area of public health to work in. And sometimes I have to have conversations with myself being like, all right, what can we get done, this semester, this quarter, because it can get a little overwhelming. So taking that moment to realize what is, top of mind has been really helpful. And, just because we've been around for a while doesn't mean that it's like we're learning new things every day, and like the environment within DPH is changing, the academic institutions are changing. So I think there's a level of flexibility that's also needed when doing this work as well.
Thank you both. And Mayella, any last words from you?
No, I think Sarah and Chrissy, thank you so much for sharing your experience with us, and for shouting out the resources that we have. And I'm happy to answer any questions or set up calls with anyone that wants to chat a little bit about their AHD partnerships or kind of how to start their AHD partnerships. So yeah, I think that's all I have. Thanks, Carol.
Thank you. And as the time is approaching that 90 minutes, I just wanted to again thank Sarah, Chrissy, and Mayella, and all of you who have participated in this session, and the great chatter going on in the chat. We'll hopefully got to most of those questions. Please join us for the closing panel, continuing our successes in public health, advocating for the workforce. And this will begin at 3 p.m. Eastern time. So we have about a 30-minute break. Just a quick reminder, you do need to log off and back on to the Train Learning Network conference page to access the Zoom link that, for that next session. It should be arriving in your inbox in just a few minutes, as it will be delivered 30 minutes prior to the start of that 3 o'clock session. Thank you all, and we hope to see you shortly for our closing session. Thank you.